Terrific, thank you. Good evening, everybody, and welcome to the COVID-19 Recovery Working Group meeting, Tuesday, 2nd of March, 2021. Great to see everybody. Shall we begin with apologies for absence? Sorry, Councillor Carter, sorry.
Councillor Andrew Johnson and Councillor Russell Perrin.
Lovely, okay, thank you very much. Declarations of interest. Are there any? No, there are none. Thank you.
Well, I think, Chair, as a precaution, I need to declare, council appointed, remunerated, non-executive director of HCS, just in case something crops up.
Okay, and in that case, I think I know what's going to happen now. Councillor Charles.
Yeah, thanks, Chair. I'd like to declare an interest as a council appointed and remunerated non-executive director of the HTS Group and HTS Regeneration and Housing.
Thank you very much. Okay. Item 3, minutes of the last meeting. Are there any comments? I thought they all looked in order. No? Okay, thank you. We'll take those as approved. Does someone need to propose them, or I can't remember? I think they're just approved, aren't they? Yeah?
Yes, they are, Chair.
Thank you. And any matters arising from the minutes? Item 4. No? Okay, thank you very much. Item 5, update on the COVID-19 position. Andrew Bramage, I'll hand over to you. Thank you for that.
Thank you, Chair. We sent out this afternoon the latest weekly update report to members. I appreciate most of you probably won't have had a chance to go through that, but I will give a quick summary. And also, since that was written earlier today, we've had the latest COVID figures published late this afternoon, so I can even give an update on the report that was sent out earlier. So we've seen over the last week overall a continued decline in the COVID infection rate in Harlow. The rate of that decrease has been somewhat slower this week than in the previous few weeks, which is probably not surprising given the numbers now are increasingly lower. So we've seen that some fluctuations. It went up for a day or two, but actually that was pretty much mirrored across Essex. Actually, a lot of authorities saw small increases in the last week as well. But as of today, the latest Harlow rate is down 89.6. So we dipped below the magic 100 number over the weekend for the first time since the beginning of November. So that's quite a major landmark, I think. The national average is 97, so we're below that, but still above the Essex average at 72. And there are a couple of other Essex authorities that still have higher rates than Harlow, Colchester and Tendring. The other thing to pick up from the numbers, really, I think, is that the positivity rate continues to fall. That's the percentage of people who are tested that are then positive. At the height of the infections, that had reached 25%. So 1 in 4 people getting tested in Harlow was coming back with a positive test. We're now down at 4%. So I think that demonstrates that the level of infection throughout the community is relatively small compared to where we were, certainly. The other thing I wanted to pick up today really was the vaccination numbers, and we've seen the national figures for a few weeks now, and the great progress that has been made on getting people vaccinated. We've been looking for district level information for a few weeks now. We've been told it was coming. It was finally published for the first time at the end of last week, and so we're now going to get weekly information at a district level of the number of vaccinations. So as of last Thursday, when the figures were published, in Harlow there were 21,252 people that had received at least one dose of one of the vaccines. So clearly that's just under a quarter of the total population, which is quite a significant figure, I think. We've had that is broken down in age groups, those under 70, those between 70 and 79, and those over 80. What isn't published are the percentages, so we just get the absolute numbers. What we are going to try and work out is where we think that is. I've actually had this afternoon some information from our policy and performance team on population figures from the Office of National Statistics. I haven't had a chance yet to go through all of the categories, but in the 80 plus category, it looks as though about 88% of Harlow residents over the age of 80 have had the first dose of the vaccine. Probably equates to about 400 people that haven't had it for whatever reason. I believe from colleagues who've been involved in Essex public health meetings that that's about the county average in the high 80s for the over 80 age group. So we're sort of on a par with the rest of the Essex position. So we'll get those figures on a weekly basis now, and on the weekly reports from now on, you will see a little section in there with an update on the vaccination numbers that will appear, well, from the report you've had today, but it will be updated from next Tuesday. So I think that's it for today, Chair.
Thank you, Andrew. I just want to apologise. My internet, my Wi-Fi went odd during that twice. So there were short sections that I didn't catch, but I think it was only me and not everybody else. So on that basis, I think we'll proceed. But if there are questions about anything I am not across, I do apologise. And I have read the report closely, and I think I got 95% of that. Councillor Durkin.
Yeah, thank you. I've just got two questions. One is, Andrew, does the statistics break down to the BME community? Because we're all concerned that while certain groups, sort of white, there's very high uptake, but certainly we're picking up throughout the whole country that there's still an issue with the BME community. And if so, can you just remind us what we're doing about that? And just as a point of interest, I got a letter yesterday saying I was entitled to a vaccination. So I went online to try to book myself, but the only place I could go is Loughton. There was nothing more local, 7.8 miles I would have to travel. So I personally decided I'd probably delay it. And I'm just wondering how many other people are delaying it because they're not able to get the vaccines as local as they should. But to be honest, I'm more interested in the first bit, which is the BME community. If we've got any statistics, please.
Not at a local level, no, we don't. There are figures published for ethnic minority communities, but only at a regional level. So there is East of England level information about numbers of people vaccinated in different ethnic groups, but it's not at a county, let alone a district level. And again, it's absolute numbers and not percentages. So it's unless you knew how many people were in each ethnic group across the East of England, it would be difficult to see what impact the programme is having. I would hope as the weeks go by, the data that's published provides a greater level of granularity than we have at the moment. On the second point, I know that about 2 weeks ago, we were told that there was, there'd clearly been a big push to get to the 15 million people figure to vaccinations nationally by the middle of February, and that the supply of vaccines was tailing off thereafter as new supplies were being manufactured. So I think there was an expectation that there would be 3 or 4 weeks from the middle of February before the supplies caught up with the demand. But I believe, over 50s, not that I'm suggesting you are over 50, of course, Councillor Durkin, but over 50s are now increasingly being called, but it may be that the first available appointment is not a local one.
You're muted.
I think Councillor Charles was next.
Thanks, Chair. And just to reinforce on the BAME community in particular, Neela Hibbert very kindly spoke to me and gave me a briefing on the work that the Harlow Ethnic Minority Umbrella Group are doing only a few days ago. And they have absolutely concentrated on targeting some of the groups that may be more reluctant to go and get vaccinated. And I think it's important, given the excellent work that Neela does in the community with other ethnic groups across the town, and in fairness, Neela has always credited the working relationship that she has with Harlow Council officers in particular, for working with her to make sure those communications keep going. But equally, what the NHS West Essex CCG is doing as well, to work with her. So those communication lines seem to be working, but it's just full tilt trying to get those communities to get out and get vaccinated is what the message that Neela was kindly just letting me know, some of the challenges they've also faced with the networks that they've got. The other point I'll just briefly make, obviously the vaccination program in this town has been a massive success, and we should all recognise the efforts of the volunteers, the CCG, and all the medical professionals, some retired, that have come back in to do this effort. And it shows that the collaboration and what can be actually achieved at large scale in this town and then also nationally. But we cannot lose sight that we've got to encourage the younger age groups to get vaccinated as well. So what I don't want this group to lose sight of, and I appreciate that this is going to move in future to subgroups to focus on specifics, but that is going to be a real challenge now, to keep the numbers of the age groups as we go down the list getting into the vaccination pods and getting vaccinated. It's absolutely crucial. It's one of the big communications challenges I see going forward.
Thank you, Councillor Charles. I just wanted to make a comment before I bring the next person in, that what has really been on my mind a lot in the last couple of weeks is how, unfortunately, our councillor corps, I'm not quite sure if that's the right term for us, but as members, we are not representative of the communities that we would be liking, we'd be wanting to be communicating with and engaging with at the moment. And I think, one of the legacy issues for us should be to really focus on ensuring that our community is represented as fully as possible in elected representatives. I think Councillor Holcoop, in the interests of gender balance, and then Councillor Edwards, if I may.
Thank you, Chair. A couple of points. It's been said by the scientific and medical experts that it's not necessarily going to be the same vaccine that we get every time we have it. But I assume when we have the first one, we're going to get the same vaccine type for the second vaccine. Yeah, Tony, you're nodding your head, yeah. Right. But it's the follow-ups that we, when we get it on an annual potential basis, that we may get different vaccines because the immunity system needs to not get too used to that one type. And the other thing, as Eugenia said, and Joel, that when it comes to the annual vaccines as with the flu jab, this is including the whole of the population that are getting the corona vaccine, whatever the age is, apart from perhaps the very young. We've got to also make sure that the younger ones get that one as well, because they may get quite lax after they potentially had the 2 vaccines that they need when it comes to the annual ones that we then start kicking in the future years. Thank you, Chair.
Thank you, Councillor Holcoop. Councillor Edwards.
Yeah, just an observation, really, or a question. Are we keeping economic data as well as the sort of health data? And would it be possible to get that report? I was thinking in terms of the economic impact of COVID as it rolls out, in terms of whether it be the number of people,
job losses and that.
Yeah, job losses, universal credit, etc. Free school meals, and various other economic indicators. And I just wonder whether or not I think it might be useful. Certainly now that the on the health side things are moving forward, but I was listening to something on the radio today, and the Resolution Foundation saying that they anticipate some of the real economic impact starting to come in around about sort of September time, and about sort of and just sort of wonder whether or not, either with the Department of Employment, etc., whether we could also feed those figures that they've got into this.
I think that's a really good. I think that's a really good point, Councillor Edwards. Will we start to get that sort of information at a district level, or does it come through at a county level? Andrew or Brian, can you advise?
We do get that at a district level, and we do keep tabs on things like unemployment, and that's broken down by age groups. And what we've seen is that there was a big spike in April of last year. Since then, actually, it's been pretty level. And I think it's right to say that the biggest impact is yet to be felt, and the furlough scheme in particular has probably masked the extent of the economic impact. And when that ends at some point in the summer, we will perhaps expect to see rises in unemployment, particularly youth unemployment. And yes, of course, we will be monitoring that, and that data will be available, and we can look to include what we can of that in these reports.
Thank you.
Sure, thank you. Any other questions or comments on this item at this point? Brian, yes.
Yes, if I can just make a couple of points. Firstly, going back to the BAME community and the hard to reach, mustn't forget that the community forum is also meeting, and they're getting all the information, all the resources to go out and spread that information. I know Neela's on that, for instance, and I have regular meetings with Neela and give her all she needs to get out there. But the main point I wanted to make is I don't think we should go through this item without recognising how well the Harlow residents and community have done over recent times. To get the figure down to where, if you remember, only a few weeks ago, we're talking about 1,400. We're now down to just under 90. And, it's a phenomenal effort by most of the community, abiding by the guidance, rules, etc. And also, of course, in going to get the vaccinations. We've heard the figures for vaccinations, and I think the residents should be recognised and praised for that. I didn't want to lose the opportunity of saying that. Thank you, Chair. I think Eugenia's frozen.
No, you just stunned us, Brian, that's all.
Definitely hush.
Absolutely. We're just taking all that in.
Janie's definitely frozen.
Isn't she?
Well, if we finish, Mark, do you want to take over? Should we just continue with the agenda while Eugenia gets back on?
I would find it quite difficult to take over, because I can only if in order to be on the screen, I can't see the papers.
Okay.
Have you got the papers in paper copy with you, Tony?
Oh, good God, no. I'm paper light. I'm paper light. But the next item is response to the government's COVID-19 roadmap, isn't it? Thank you, Sank. Yeah, I can do that as well. Well, I've got it. So is that going to be Andrew or is that going to be Brian?
A mixture, really.
Okay, why don't you start, Brian, while we try and resuscitate Eugenie?
I will do. Obviously, exactly a week ago now, wasn't it? The Prime Minister set out his roadmap with the 4 steps. We have, as a management board, met on a regular basis since then to ensure that we're ready to open our premises, well, to restart any services that ceased at the appropriate time and based on the data as well. And that has been very successful. Obviously, the 8th of March is that's Monday, primarily about the reopening of schools. And hopefully all members will have received a letter today, an email today from Councillor Ray Gooding, who's the portfolio holder at the county responsible for education, setting out that the schools reopening in Essex and the plans for lateral flow testing in particular, which largely follows the government advice. We then go to the 29th of March, when, as far as we're concerned, particularly with opening outdoor sports facilities in the town park in particular. And then the crucial date for us, of course, will be the 12th of April, when other things, including Pets Corner, can open. But we're getting a roadmap together. We know where we're going, but the important thing is that we are ready to open or to start services at the appropriate time. And with our management team and our third-tier managers, we've been aiming to ensure that is the case. I just wanted to update members on that.
Okay, thank you, Brian. So, Mr. Bramage, did you want to add to that before I go to hands up? That's looking like a no. So, Councillor Carter.
Sorry.
Oh, sorry.
Andrew's with us now, I think.
No, sorry, I was muted. But no, I didn't have anything to add.
Okay, good. So we've done Andrew. Now it's the Carter.
Just wondering if Mr. Keane can comment on any discussions, negotiations they're having with HTS over the extension of their services and what the council requirements, what the council is actually looking for.
Yes, I mean, John Phillips, the managing director, actually attends our meetings, and he is going through a piece of work at the moment with Andrew Murray and with Andrew Bramage from the environment side, but primarily Andrew Murray from the housing side. So they have a joint vision, joint roadmap to go ahead, and I believe that will be completed by the end of this week. So, Councillor Carter, you can obviously speak to John, but he is very, very engaged in the process.
I had a feeling you might be.
Thank you. Any more questions or comments on that item then? Councillor Edwards.
Yeah. I mean, hopefully it'll all we'll start to move in the right direction. And one of the things that comes to my mind, I believe this year is likely to be the 50th year for the Playhouse. It would be great if we could start thinking, well, sometime later this year that we could have some event or some way of sort of celebrating that, which is COVID compliant and all the rest of it. But that's part of the sort of strategy of opening up. Just a thought.
Before I come to you, Councillor Charles, I think Simon Hill wants to add to that, and then I'm going to go to Joel Charles, and then Eugenie, you're back. You can take back over.
I just wanted to reassure members that, yes, of course, we are going to acknowledge the 50th anniversary of the Playhouse starting in November, and Rory and his team, together with officers across the council, are looking at appropriate celebrations of that over the year that starts in November 2021 through to 2022.
Brilliant.
Councillor Charles, and then I'm handing back over.
Thanks, Chair. So just in terms, Brian, of the mechanics of implementing the government's roadmap, and you talked about March, but obviously the April, May and June deadlines as they sit at the moment with the roadmap, but that may change depending on the success that we continue to see with the vaccination programme. In light of what Councillor Carter said, what level of integration is there between, just in operational terms? Obviously, HTS has its own systems for understanding the backlog of matters that need to be addressed, that have had to be parked because of the pandemic, and they haven't had the same mobility as they used to have during these unprecedented times, and the connection with the council systems. Just at a high level, from an operational perspective, how we're going to deal with the backlog of some of the critical cases and support that people need. We've touched on this before in previous meetings, but how is that catch-up going to operate? And then from a forward planning perspective, clearly in council facilities there will still need to be the appropriate public health measures, whether it be hand sanitizer or adequate partitioning, to just keep the messages around social distancing. Although the government has said that it sees a complete phasing out of social distancing measures in the summer coming on the horizon, I still think that people will be still anxious for a period of time, and we may want to consider keeping some limited public health controls in our council controlled spaces, and what the appetite is around that.
Thank you. In answer to the first question, we had a meeting today with SMB and John Phillips, and the question of backlog was a major discussion there because both us and HTS realised that is a challenge and we need a plan to actually get out of that. And it isn't just John and Andrew who are dealing with that. That's actually been dealt with by the operational managers at first to report back to us. So people like Neil Rowland and Wendy Makepeace are having regular meetings. They've hopefully finalised that on Thursday, as I say, but there may be a little gap there before it comes to us back to SMB. So that is very high on the agenda, I can assure you. In relation to council-owned space, I think I've been clear throughout the pandemic that the safety of staff and residents is paramount, in my view, and therefore it is very high on the agenda of what happens in the future to ensure that that is sustained. So again, I had a discussion today, particularly about the Civic Centre, about what that would look like come, say, June. And it won't look like what it would look like this time last year. It will look differently. We will still be, I imagine, be sanitising, social distancing, desk layouts will be different. That's apart from the fact of how many people will actually be in the building. So again, that is very high on the agenda because, as I say, the safety of the staff and residents is paramount.
Thanks, Brian, and thank you, Mark, for chairing in my absence. Brian, just on that, can I ask about the staff and if we are doing any work? I know we are, but just an update on the work that you're doing to understand the appetite or the sort of level of usage of the building, because clearly that's going to be something that's going to change post the crisis period.
Yes, I mean, we're carrying out an accommodation review, and part of that is the effect of COVID and the way of moving forward. So there's two things. There's the COVID safety issues, if I can call it, and there's the practical working issues. We've learnt a lot in the last 12 months how efficient things can be from people working from home, and hot desking potentially is another option. And we are engaging with staff in that. And so some staff will be regulars coming to the office, some will hardly ever come in, a lot of them will be somewhere in between that. And so we're going through a piece of work at the moment, which will be completed well before the June deadline, as to what it will look like subsequently. But I say the health and well-being of the staff is paramount. They will be engaged in that process. I mean, I was actually in the Civic myself yesterday, and I went round to speak to everybody who was in there, socially distanced, I would hasten to add. And there was obviously a number of people in contact, Harlow, as you would expect. there was a number in Revs and Bens, but there was very few other people in the building because they don't need to be in the building to do their job. Most people seem happy working from home. I think most people will probably like to do a mixture, but it's the efficiency of the service as well as the safety that's important. So all these issues are paramount, as I say, in our current thinking.
Thank you. Councillor Charles.
Thanks, Chair. Just one final brief question, Brian. The health and wellbeing partnership strategy that's for 2018 to 2028 clearly needs to be adapted to factor in where we are now. What's your potential timeline for making some adjustments to that? I'm not proposing, there are lots of things that need to be dealt with, but actually I think that strategy is quite fundamental to sort of the road to recovery for the town and people's well-being. So just to understand if there's already appetite to pull together a timeline to just make some amendments to that well-being strategy.
Yeah, I mean, clearly there will need to be amendments. There's no doubt about that at all. I have got people dealing with that. Can I come back to you, Joel, when I get a firm timeline from them? I think that's the easiest, rather than me just picking a date out of the air today.
I mean, it's something that can go into one of the behind-the-scenes working groups.
Yeah, sure.
I think it makes sense if others agree.
Yeah, I agree, and that makes a lot of sense. Thank you for raising it. Is there anything else to add that people would like to comment under the roadmap? I'm sorry, I missed part of the discussion presentation, so I'm not going to chip in. Councillor Edwards.
Yeah, I've raised previously the question of sort of what I call non-online communication strategy, and that seems to me will continue to be potentially an issue. So, I mean, I'd like to hope that within all the other stuff that's going on, that gets picked up and looked at, because a sizable number of the population of Harlow aren't online, as it were, and given the difficulties that we have, both in terms of newspaper and all the rest of it, I do feel that we need to be looking again at that, as well as looking at our online communication strategies as well. That may well be that that's already part of the process, but it'd be great for that to be borne in mind.
Yeah, certainly.
Sorry,
Does it
I'm
look
back.
like we've lost Eugenia again?
No,
oh, okay.
I'm back, but I'm just wondering, it does say it's unstable. Maybe, well, I mean, we're all but done. So let's move on to item 7, unless anybody's got anything else on item 6. No? Okay, lovely. Item 7, matters of urgent business. Is there anything? Thank you for your comment, Councillor Edwards, about the ensuring that as we come out of this, that we have better communications offline. I did note that point. Thank you. And I agree. Brian, I think you've got your hand up.
I have indeed. Thank you. Jane Greer has asked me to raise this through her. She's on leave, that's why she isn't here today. Through her work stream, they discussed an item relating to the CAB. There had been discussions, obviously, with the CAB throughout the pandemic because they've been very supportive and worked with us. Their funding for their debt advisors is ceasing at the end of March. And clearly, debt advisors at this particular point in time, going back to what we discussed earlier, for instance, on the end of furlough and everything else, is crucial. It seemed to us, and it's been through SMB now, that it would be a good use of some of the COVID money for 1 year and 1 year only to fund 2 debt advisors at CAB. Their business has gone up, activity has gone up, and as their chief executive stressed to me when I spoke to him recently, a lot of people going now for debt advice are people who've never had problems like this before, and they've totally lost. And I think for the CAB to lose their debt advisor at this particular point in time would be really bad news for the town. So we think it's good idea at this point in time to fund 2 debt advisors for the CAB out of the COVID money, and that would come to about £37,000.
Okay, thank you, Brian. And just as a reminder, we have, I think, £150,000 set aside, so it's well within the budget available. Councillor Dirk and then Councillor Ingle.
Sorry, I was just going to support what Jane was saying. I had a conversation with her last week, and we were looking at a number of funded projects that we will be making an application for. But actually, for the 2 debt advisors, I think we actually need that. So I would welcome and I would endorse that recommendation. Thank you.
Thank you, Councillor Dirk. And I know you said you're bringing forward a number of recommendations for spending. Councillor Ingle.
Yeah, I can think of few interventions that we can make which will have such a wide impact as funding the debt advisors at CAB. So I'm wholly in support of that suggestion from Jane Greer. Thank you.
Thank you. Councillor Edwards.
Do we know what the funding stream was before? I mean, why has it come to an end at this time?
It was, as I understand it, Tony, it was funded by a charitable organisation, and presumably their money has gone elsewhere, or they haven't got the money at the moment. I don't know the background to it other than that.
Right. I think, as well as, I'm obviously in agreement to the, the funding in the interim, but I think again we might also need to look over this next year, depending upon how the economics of this rolls out, as to looking again at the strategy around welfare rights advice, etc., how that gets adequately funded, probably in a partnership way with the county council or whatever. But it's about trying to ensure that there's a robust level of service there. Might be a need for a review of that at some point.
Yeah, I mean, I'm absolutely don't understand the funding of the Citizens Advice Bureau, but it does seem extraordinary to me that they can be left in a vulnerable position at this point in time. Simon Hill.
Yeah, I mean, I'm not an expert about that contract, but I do know from Jane that the intention is to look at welfare rights contracts again. That's due to come up again over the same timeline. So it would be appropriate to look at that as part of that contract and what options are available going forward.
Where would that get picked up, Simon? In what?
Well, through normal executive procedures.
Right, okay.
Yeah.
Will it need a scrutiny thing? That's all.
It's really for scrutiny to decide what they scrutinise over the next year, and that will come out in the programme for next year. But certainly in the same sort of timeline, we will be looking at that contract again. It's due for, it has a fixed period, I understand, and it's due for renewal.
Okay, thank you.
Okay, lovely, thank you. So not that this group approves, Brian, you want to come in?
No, carry on, Chair. Carry on.
Oh, well, not that it has gone through the SMB process, and the recommendation from SMB is that we make this contribution. And I think that this group, if we can send a signal of support, which I think we have wholeheartedly, then that is useful and good practice. So I'm going to assume, unless anybody says otherwise, that we fully support this in this investment, spending of this money, for want of a better description. Okay, great. Any other items of urgent business before we conclude? Brian.
Sorry about this. I think we just need to touch on the fact that the subgroup met last week, and it will be meeting again in a couple of weeks' time to look at, first of all, to make sure the strategic vision that we set ourselves a few months back is still appropriate in these changing times, but also to look more closely at the roadmap. So the subgroup will look again at that and then report back to this formal meeting. I just wanted to put that on record.
Thanks, Brian. And also just to add to that, as members know, we added an objective to our corporate plan, which related specifically to the COVID recovery and brought that right into the mainstream of the council activity. So I think that's an important consideration here, and obviously recognises the reality, which is that the recovery from this terrible pandemic is not going to be measured in the short term. It's going to be an ongoing matter for us to respond to and cope with, potentially over years, I would say. So that will bring the work into the mainstream of the council, which isn't to say it wasn't, but rather than being a separate working group, we will also be looking at it through the regular council processes. Okay, anything else to add at this stage? I would just like to say we had another third very, very good business breakfast last week, and the next one I think is on the 19th of March, and really to encourage any local business to please join us. It's a very informative and lively and highly, we have fantastic engagement and very good feedback, and very grateful to Red Church Brewery for donating a lucky door prize last time, which was won by a local business. And I'm very keen to embed the lucky door prize as part of the Harlow Business Forum breakfast, which is, of course, with the Chamber of Commerce as well. So everybody's welcome to that.
Eugenia, the agenda next time is about public transport. And we've got the bus companies coming in, and we've got Essex County Council. So it's actually how do we get people from A to B, which I think is going to be quite interesting and fascinating about our future design. So I echo, it's really successful, really successful.
And the focus of last week's breakfast was around apprentices, and it was really very inspiring to hear some of the local case studies. So if anyone is watching or interested in that, definitely watch the recording. There was great content. Okay, I think that brings us to a close, unless anybody has anything else that they'd like to share. Obviously, just to say thank you again for making the time. Thank you to members of the public who are watching, and wishing you all a good week.